Hello everyone, Omar here. I just wanted to make a very quick video talking about OCD and I guess the current coronavirus. Now, if you're somebody with OCD or Obsessive Compulsive Disorder, primarily when it comes to like hygiene and cleanliness or contamination, well, with everything going on with the coronavirus, you might find yourself, or you might find your OCD possibly being triggered, and I guess I just wanted to talk about that really quickly. Now, how does OCD work? By definition, you have these involuntary thoughts, obsessive thoughts, and they can possibly make you behave in some form of compulsive way. And since we're talking about hygiene, it's like washing your hands over and over again, and then you ask yourself, well, did I wash my hands? And you doubt yourself, so you go and wash it again, and then you come back, and then you're like, but did I wash it properly? And then you come back. So your thoughts are sort of obsessing over whether your hands are clean, and then it's causing you to, I guess, behave compulsively, if that makes sense. Now, there are ways to treat this, and usually it's wise to possibly speak to a psychologist or a counselor who's versed in this sort of thing to sort of, I guess, help you out. But I don't want to drain this video. I just wanted to share, well, one, I wanted to shine light on this, and I also wanted to share just a few pieces of advice that possibly may help, hopefully. Firstly, it's important to sort of, I guess, disconnect yourself from anything that may possibly trigger your involuntary or obsessive thoughts. So anything that may be a trigger to you, and you may already know of some of them, but obviously now with the onslaught of news and social media talking about coronavirus, it doesn't really help. So it's important to sort of reduce your exposure to those sorts of things, because they may be triggering your involuntary thoughts, if that makes sense. Now, obviously, you need to be kept up to date with everything that's going on, especially as things are constantly changing regarding the coronavirus. But it's, if you're seeing, like, let's say, for example, you're on social media, you're on your phone, or you're watching multiple different points of news, you're seeing every single angle of the coronavirus. You're seeing fake news, you're seeing real news, you're seeing people's experiences, you're seeing people's opinions. Like, you've got all this information coming in, and that may actually trigger you, because all of these pieces of information are saying to you, well, there's bacteria coming to get you, and that could be a trigger for you, if that makes sense. So it's important to sort of disconnect yourself from, a lot of the noise that's going on. But keep to maybe one line of, I guess, news that can keep you up to date with everything that's going on. Okay, I have one more point. Yes, okay, so the main point of advice that I want to give, and it's going to sound maybe funny, but it's to try and take control of your thoughts. Now, this is obviously a lot easier said than done. But once we understand, once we have the awareness more so that our thoughts can be causing us to act in or behave in a certain way, this awareness sort of arms us with the ability to fight back. Now, with the earlier example that I gave, did I wash my hands? I better go back, wash them again. Well, if you know you've washed your hands, you can actually start fighting back with yourself a little bit. Now, it sounds very negative, you need to fight back with yourself. Let's use the term push back. So you sort of push back and you say, no, I know I've washed it. Now, it's not going to happen straight away, but hopefully this step in the direction of taking control of your own thoughts helps you in this journey, or at least provides some sort of relief in I guess, tackling your symptoms of OCD, especially now with the, I guess, current situation of the coronavirus. So hopefully if we can take a step towards, taking control of what your thoughts are telling you and possibly replacing those thoughts. So another example is, okay, well, have I washed my thoughts? So have I washed my hands? You know you've washed your hands, and you're basically telling yourself, no, I know I've washed my hands. Or like, oh no, I have wiped the table. Or, I guess other thoughts like, no, I am socially distancing myself from people. It's actually okay. I'm fine. So when you're able to tell yourself these sorts of positive things, hopefully it reinforces some form of positive thoughts that can tackle the negative thoughts even subconsciously, if that makes sense. I know it's a bit of a tricky one, because once you're diving into thoughts, it's a whole realm, of understanding of what to do and that sort of thing. Hopefully I was able to shine a little bit of light on OCD and I guess the hygiene aspect or OCD in regards to hygiene. So yeah, hope this has helped in one way or another. I don't know if it's the right thing to sort of tag people in these sorts of videos, but if you think that it might help somebody else, it might be wise to share it so that somebody that does need to hear this can hear it. So thank you.